Good morning, everyone. Welcome to the Rhodes Monthly Checkpoint. And as you can see on the first slide, it's all about EDI. Well, it's Rhodes in general and focused on EDI. So in other words, the Jody Kramer show, as we like to call it here.
And Pete
Welcome,
Vermeer.
everyone. Well, of course, yes,
And Pete
I'm
Vermeer. So,
back in the picture, definitely.
yeah.
As you might or might not know, we do these monthly webinars every first Wednesday of the month at 9 o'clock. And we focus 1 week more or 1 month more on EDI and the other month more on the actual data entry and the portal. The focus is more on the treatment providers who use the portal, and although there are not that many anymore, the majority is really has its own EHR or EMR, and that's the focus group for today. So, Kelly, why don't we start with the agenda and see what's going on for today? Wow, 17 things. That is a record, I think. Um, Welcome, and I already said that. And for those of you who are not familiar with it, we do record this webinar. So in case you get called away or there's some emergency going on, you can always go to our website later and re-watch, listen to it, and see if there's anything you've missed or there was an item on the agenda that kind of piques your interest and you really wanted to, or you wanted to share that with co-workers or individuals part of your organization. It's very quickly these days, within a day or two, and the whole recording will be on our website, and you can kind of take your time and kind of jump through it and pick the pieces that you would like to see again or share with individuals, or make sure that you get the information that you're looking for, hopefully. Okay, that's the agenda. First, a quick look of the team. There we are. Kayla, Jody, Lisa, myself, Justin, Anna, Mary, Cecilia, and Kelly. The titles are there, and this is our core team. We also have other people within our organization, and we have OIS people, and we can always ask them for help if we need any information from anybody. So, okay, why don't we get going? Because there was a lot of things on there. Okay, on the alpaca scale, how do you feel today? 1, 2, number 4, 5. A solid 8. Wow. I'm between 4 and 8. Kind of like, oh, cool. No number 9s yet. That one really looks stumped to me. So that happens to me off and on. So anywho, this is just a little thing that we kind of like to throw in to get people's attention and see how you feel, and hope we all can have a good time with this webinar that we are playing today. So, okay, next one is, oh, sorry. Why do we do this? Well, of course, to communicate to you, to give you information, because there's always something happening in roads, and we're still currently in phase 1, and we know that we are working on getting close to move over to version 2. So any information, updates, enhancements, anything that's changed or will change in the future, we'll let you know. We'd like to discuss data issues. If there are certain parts of the system or certain data items that are coming through awkwardly or feel like a bit off, that maybe there's a misconception somewhere, then we'd like to just take this hour to discuss it and or show information about what the information is we're getting from the system, and maybe information that you would like to see or share within your organization. Also, we'd love your feedback. If you have any feedback, if you have any questions, any ideas for future webinar topics, just let us know and we can work it in. We can always make room, and there might be things that you're struggling with and that definitely other organizations might have the same issue. So if there are any questions that you would like to be answered, we have the webinar here. This is the platform. Teams seems to be working very neatly. I'm getting more and more familiar with it, and I'm beginning to get used to it, and it's I'm kind of liking it. It's not very different from other ones, but I'm comfortable with it, and I think that's the main thing. So, okay, and the next one is the update for MCIS MRSS. Jody, go ahead.
All right. Yes. Good morning, everyone. We wanted to kind of call out this because there are a lot of the providers, a lot of the what we call CMHPs, which are typically the counties or another organization providing that, as well as some subcontractors that are in the mix here. And so for the longest time, when MOTS was frozen, mobile crisis values were not able to be added to the standard crisis. So you have a process was set up to fill out a template, and for mobile crisis and for mobile response and stabilization services, those templates were filled out and they were sent to Oregon State, no, Oregon Health Sciences University. Get my acronyms straight, OHSU. And what we found is that the contract has come to an end as of the end of June, and we're going to do a temporary data shift on where those templates are getting submitted. There was a decision made that in order to reduce administrative burden, the folks providing these services would not be required to enter these services manually into the roads portal. These mobile crisis and stabilization data values and elements are included in the EDI version 2 for the roads system. But we know that since you haven't had those documents available to start building to that, there's no way you would be ready to submit EDI files on, for quarter 3 or quarter 4. So our manager got a opportunity to extend what you've been doing, but you'll continue with that and send it to compass.support at the deal there, odhsoha.oregon.gov. So instead of going to OHSU for quarters 3 and 4, you'll send them to the Compass support. For the end of June for quarter 2 that you've just completed, that will go to OHSU as usual. Now, what we will be doing is when we get closer to the end of the year and we've had an opportunity to see where the different EHR systems are at, there may be conversations of extending this ability to send these templates to us here versus manual entry into potentially quarter 1 of 2026. So I think a lot of you will be excited that this is what you get to do versus trying to manually put all of that data in the portal. And hopefully this shift will ensure, uninterrupted data flow as usual as we get the road system and you all get your version 2 built out, which will include all of this. And just to let y'all know that version 2, we built version 2 for these two aspects off from that template that you have been sending to OHSU. So if you've built things in your systems to collect this data, we did use the same data points and values that were there for each of them. So yeah, exciting news. Any questions on that?
I'm not seeing anything popping up, Jody.
Okay, super.
Looking in the
All right.
chat, and I think it's
Yeah.
good. So
The only
thank
other
you.
thing I would say is if you're unsure if you do these, just contact us and we'll help you figure it out. I had one contact me yesterday and we were able to kind of drill down into who at their organization was doing these things. So
Excellent. Thank you, Jody.
Mhm.
But you're not done because you're going to talk about EDI
I
documentation.
know this super
Yay!
exciting. We needed a drum roll right here.
Right.
Yeah, exactly. 3 years. So the EDI documentation is ready to go, and this is for real. The data dictionary and the EDI file specs guide have been finalized. We plan on sending them out this afternoon. So they'll be going out to the roads distribution list. They will also be going out to the contact list that Pete and I have maintained over the years, which has all the EHRs and the EDI folks that we interact with. This was a heavy lift, and thank you for all the little hand claps because it was a lot of information, a lot of business rules, a lot of double checking. I'm sure we'll possibly stumble across things as you all get your eyes into them, but we feel very confident that they are extremely complete at this point. So for everybody who's wondering, the V2 data dictionary obviously will include the regular like assessments that you were sending for somebody who comes in and you just give them an assessment and they don't need any treatment further, just a basic one. Episodes of care are included like before, behavioral health, substance use, or co-occurring. We still have the standard crisis in there. We have added the mobile crisis, and we have added mobile stabilization services. We also have Real D in these documents. The Real D was built upon the Real D specifications from the Office of Equity and Inclusion. So we didn't go out and create our own one-off. We used what they have been requiring. We also have involuntary services still in there, the pre-commit things. We do have some new fields for additional information on placement orders. And we have non-Medicaid services still. We did add in and amongst the episodes of care, discharge dates, last seen dates. We also added the ability, if you've got somebody in co-occurring treatment, when they finish their substance use, because typically that finishes sooner, there is the ability now to give a treatment status reason for discharge on the SUD, as well as its own discharge date and last seen date. So I know a lot of you will be super excited about that because in the past, without having those called out specifically, somebody might have completed their SUD, but maybe they left against professional advice 2 months later when they were continuing with their, mental health services, right? So then that doesn't give a real good picture of the SUD. So we really put a lot of thought into these. We've worked with program staff, all kinds of folks. So it will definitely be something for you to intake. What I will say is once these go out, we are planning on setting up at least 2 Q&A sessions as a whole, which would mean everybody who wants to come will do a Q&A session after you've had, probably be 2 to 4 weeks in after you've had time to look at these. And then we will be drilling down into EHR specific sessions. So, there's a lot of EHRs that have many providers. And so we will be doing targeted sessions with each EHR and their specific providers individually so that we can kind of get a barometer on where each EHR is at. So this is when probably all the work's going to start. And so we luckily have broadened the team. Pete is back in action. So we will definitely have resources to help you all out with this transition. And did somebody have their hand up?
Lisa
Lisa.
has her hand up, and I was wondering if you skipped Burn on purpose, or
Oh,
is that for a
no.
separate audience? And maybe that's
Oh,
what she
no,
wanted
no,
to
no,
ask
no.
about.
No,
Thanks,
no,
Pete.
no. This is
You're welcome.
sorry. Thank you all for whoever brought that up. I was going through them in my brain, and I'm not sure how I escaped that one because that has been a massive lift. So all of burn is included in there. We do have another slide on burn, but all of the burn reporting at the client level and for the housing, the peer support, the SUD, the screening, the harm reduction services, all of that is included. So I apologize for leaving that out. I don't know how it escaped me because it's been a lot of time there.
Excellent. Thank you, Jody. Yeah,
Yes,
well,
yes.
I I wasn't sure if it was in other slides because I knew Kelly was still working on it yesterday, so and you had some ideas. So why don't we go to the next one? See what Kayla Camelli has. I saw her name on there.
Yay.
It was
Go,
MFA.
Kayla.
Yay, and then we'll get to the burn providers. There you go. Go ahead, Kayla.
Yay. Hello, everyone. I get to chat with you about multi-factor authentication. So we have not yet rolled out training for EDI providers in the portal, but we will be doing that in the next, we'll be organizing it and then releasing it in the next couple months. Because roads is different from MOTS, EDI providers will have more opportunity to engage in the portal and use the portal to look at files that get submitted and do some additional administrative tasks in there. But in order to get access to the portal, you will need to register with the state as a user of one of our systems. So that means you will get issued what's called a P number, which stands for partner number, a user principal name, and those will be used in conjunction with a cell phone or a YubiKey to verify your identity before you log into the portal. So if you don't have a P number or a UPN at this point, we can get that process started for you. We will put in the chat our user request form, and you can use that form, plug in the information, and then we can request that you get issued those two things so that you'll be able to access the roads portal. And then if you have those things but don't have MFA set up yet, the way to do that is by calling our service desk, and that's the number that you see here on the screen. I'm not going to read it. And they can walk you through the process of getting that Microsoft Authenticator app and then utilizing that app to confirm your identity within the state system.
Kayla?
Mm-hmm.
I think one of the things you might want to call out is that this access to the portal is only for providers. It's not for the EHR systems themselves
Yes.
or their,
Mm-hmm.
yeah.
Yeah, this will be for providers specifically. And I think, what else would you like to add to that, Jody?
The other thing I'd like to add is just that so this access that Kayla is referring to is literally for you to log into the roads portal. There's some things for you all to see information on your literal clients, past information on them, dashboards. There's an area where you can a little tool for using looking at your submitted files. So this is specifically for providers. As far as the EHR systems and the actual file submissions, right, that is still going to happen through the FTP server like you have been doing. So if you have a system that automatically sends those for you, that will continue as usual. If you are the person who creates these reports out of your system or picks up the files to be sent to the state, that will still be through the FTP and your file transfer software, such as, excuse me, FileZilla, Core FTP, WinSCP. Those are a few of the ones. So there's two different things that we're talking about, and hopefully that clears it up some. Yes, no, maybe.
I think so. Not seeing, or am I missing a question here or there? No, I think that's good. Okay. Thank you, Kayla. Thank you, Jody.
Yeah, yeah.
Back to Jody. If I,
Okay.
yes, there you go. Burn providers.
There we go. So the burn information. So a lot of you who provide this, this stands for Behavioral Health Resource Network. Used to be called Measure 110. It has been rebranded with an appropriate title now and an acronym. Some of you who provide these services, you have been receiving emails and information, and you've been attending things that are telling you to, oh, can we go back? Oh, there we go.
Sorry.
That are telling you to sign up, get registered to be a burn provider. You get, inroads, and that is true. But we want to call out a few things. One, even though it's bullet number 3, if your organization is already reporting to roads, so for example, if you were, Baker County and you're already submitting to roads and you're already putting data in, you do not need to fill out and register again for the burn services. Your access agreement form that you already have with us will cover the data for the burn resources. So you're not going to have to do that again. All the information on when you need to report the burn services and what the timing and the thresholds are will be available later when specific trainings are being rolled out for the burn agencies. The people that will be attending those are going to be the ones that literally are burn service providers. We have separate ways in the system to silo your ability to send that data or not. So more information to come, but if you're getting nervous about, oh, I got to get registered or I got to get all these things in place, if you're already submitting to roads, you're already probably 50 to 70% there. The EDI documentation will show all of the burn fields and the burn development that needs to happen. So just more to come on that. If you're ever in doubt, just contact us directly at the email that Lisa had provided, and we will get you more information because it's an ever evolving kind of topic. This is a new way of the reporting to be coming in. So, so with, I see a question in the chat that's kind of got me a little squirreled. Is it okay if I address that?
Or Lisa had it, or was that Lisa? Did you want to point out to the question?
That was it. Yeah.
That was it. Okay, yeah, go ahead, Jody.
So Trent is asking, how does the transitioning from version 2 work for EDI? So what's going to happen is everybody is going to continue using version 1. You're going to continue doing what you're doing today. So keep submitting the files that you've been submitting to MOTS that are now coming into roads. Okay. Basically, we are looking for, we know it's going to take everybody time to develop. We and our leadership knows it could be 3 months, 6 months, 12 months, depends on who which one it is and who's doing what stuff. So you'll continue to submit your version 1 even when you're testing and certifying for version 2. So we won't stop version 1 until you're certified with version 2. And once you're certified with version 2 and ready to go live with it, we will then give an expiration date on your MOTS version 1. The other thing is that there will be a cutoff date at some point. So version 1 will go away, but there has not been a date set. I told some other folks that I believe it will be in 2026 because we believe that the development could take up to 12 months per industry standards. And so our intent is to, when we meet individually with the EHRs and their specific providers, that we will be able to get a barometer of what the EHR believes their scope of work and level of effort looks like. So our leadership has been knowing that we want to be really reasonable, but we also want it to be a transparent process, with one another, because if you're like, well, it's going to take us 18 months to 2 years, like that's probably not going to work. So I would say sometime at the end of 2026, we will see version 1 have a finality date that it will be taken away. So I
Sounds
hope
good.
that helps. Okay.
Thank you, Jody.
Yeah.
Okay, the next one is Mary's going to talk about request assistance with EDI errors. Go ahead, Mary.
Good morning, everybody. I usually help providers with correcting errors, and you can continue to submit the data correction sheet as you already have. But I've noticed with the EDI is sometimes um, I'm not quite sure what the correction should be. So it'd be helpful when you have a question about EDI errors that you're receiving, that you include the file name of the submitted file and also the batch number. This helps me find the specific file that you submitted. The transaction ID helps me locate the specific error and also the client ID and, if possible, the last name at birth. This helps me to understand what the error is and how best I can help you in straightening out what may be the problem, what needs to be corrected on your end or possibly on our end. So Jody took a screenshot that's on the screen of what you would see in your results file. And that's the information that will help me, will help solve some of these mysteries. Okay.
Excellent. Thank you, Mary. Yeah, that'd be helpful.
And that was
Okay.
out of our UAT test environment. So that's all test data.
Great.
Yeah.
And thank you, Robert, for a shout out for Mary and the team. Thank you. Okay, let's go to the next one, which is Roads EDI transition. Jody. Oh, surprise, surprise.
Oh, okay. Well, this one will go by quick because we've already kind of
Covered
you know,
most of it. Yeah.
talked about this. But yeah, basically, you're going to get the documents today. They're all finalized. EDI V1 will sunset sometime in 2026. So
V1.
yeah, we're really excited to get moving and to start interacting and getting this process underway. I think that's all I need on that one because we've really talked about all that. And some of it's a
Yeah,
little outdated, so no
I
worries.
think so too. Yeah.
Okay. All right. We'll just go into this one. So file error visibility and monitoring. We just wanted to let y'all know that now with the new road system on the new platform, the road staff, all of us, have the ability to review the errors. We're able to see the results files. We have a lot of administrative tools for us, and there's also some tools for you in the portal once you do get access. We want to remind everybody that all the data is monitored nightly now, and we have actively flagged persistent error patterns. So some of you may have seen we've reached out just as a like, hey, want to let you know what we're kind of seeing as some trends or maybe some higher error rates than seem reasonable. So you are expected to track and resolve issues, promptly to try to stay in good standing, because when your error rates are like 30 to 40 to 50%, like that's not a real good barometer of success. And so we want to make you aware of that if it's happening. As well, you can see that it's happening if you're looking at your results files. And so we just want you to know with the new platform, Pete and I don't have to go dumpster diving to get to data anymore. It's just right there, nice for us to actually see and keep track of nightly. Can we go to the next slide? So along with that, there is a decertification that could happen. So if there's ongoing egregious submission errors, it could result in a temporary decertification. And we have actually done that. So examples might be submitting files without resolving errors, like week after week, or submission after submission, you're still at 40-50% error rates. Submitting incomplete or invalid data that kind of compromises the system integrity. Most of our business rules are catching that. And Justin will be, we do have some anomaly reports that go out. But it's just, we want to make sure we're collaborating, so we can make sure that the data quality, like that's our primary concern. So we know that things happen and sometimes you might not notice or know something, but start keeping your eyes on that a little bit more. And if you are concerned about that and want our assistance, we are happy to try and work with you on that. So yeah, it's kind of not the most nice slide to have, but we just want to remind everybody of this. Okay, we want to go to the next one.
Madison is asking if we have an average of errors. I'm not sure if Justin has a number somewhere.
I do not, sorry.
That's okay.
Yeah, so passing with no errors. So there's kind of three different things. When you get access to the portal, you'll be able to see this, but there's passed with no errors, which means every transaction in your file went through successfully. So that would be like a successful file. If you get failure, that means that the file itself had an issue and it was not processed at all. And then we also have passed with errors, which would mean like they pass and they have some of them were good and some of them had errors. We do know that some of you send submissions where it's more like you're batching, say 5 to 10 clients or something like that. So those, are going to be a little different because you're sending more files more frequently. But like when we get the big weekly files and, they've got 1,500 or 1,700 transactions and 600 of them fail, like that's an indicator that we probably should have a conversation. So.
Yeah, that usually means there's something structurally wrong within maybe a misconception somewhere or something that needs to be fixed. Now, little errors here and there happen all the time because
correct.
Not all the business rules that we have are in all the EHRs, EMRs that are out there. So, but over time, I think more and more are getting them. So, but sometimes they don't, and people usually put in correct data, but once in a while things slip through. So that happens to all of us. So.
Yeah. And the system is very sequential in reporting on clients. So, if you aren't reporting frequently enough or addressing the errors, it's easy for things to get out of time and step, which then causes you more errors that it kind of then will take a little bit of a team, us and you all, to get that back right sized.
Excellent. Thank you. Okay, the next one was reports for Justin.
Yeah, so we've got reports up and running, some of them, the basic standard ones anyway. In fact, the new active client list, which is active episode of care, went out yesterday. We also have the monthly crisis summary, involuntary service summary, and non-Medicaid service summary. I have not activated the anomaly reports on roads data yet. And this is because we're having a bit of a problem with the server. Roads data sits on a slower server than the MOTS data did, and the data source gets updated every hour instead of overnight. So what's happening with these big reports, like the active episode of care, that it will run for several hours and distribute the reports throughout those several hours. But when the update happens, it skips because it can't report on data that is currently being changed. which means that I've got to go back in and manually resend those that failed. It's about a 10% error rate. And we've got developers working on that. There's a solution coming sometime. I don't know yet when. But just to reduce the excess hassle, I'm going to skip the anomaly reports until we can get this resolved. However, if you have questions, if you have reports that you specifically need, let us know. We're still offering the option for custom reports. The custom reports that you had previously, I'm waiting again until those server errors are resolved. But if you need them right away, I don't mind creating them now. Just let us know what data you need.
Excellent. Thank you, Justin. And then I think it's back to Jyoti again. Yep. Road system issues. Uh-oh.
Yeah, we have a few. So want to remind everybody that the batch number already used is an error that you will get if a batch number tries to have been reused. Anytime you're doing certification files, that also consumes that batch number. So this will be important when we get to the certification for version 2 that you are going through. Is like you and your EHR might want to carve out a certain set of batch numbers to use for that. So just wanted to use that as a reminder to folks. There is also, next one is the first name update errors. We're kind of getting two types of errors, and these are slated to be resolved here at I believe the middle of this month. And we're confirming that that's going to make the cut for that. If not, it would be further out into August. But essentially, there you get two different errors. Client already exists, and this is happening when you try to update the first name of an existing client in the same facility, which you should be able to do. So this is a known issue. The fix is definitely in progress and close to promotion. The second error message you might get surrounding the same issue is check client overlay. And this is triggered when the system detects a mismatch in the client identity. So like the same last name at birth and date of birth are correct, but the first name has been updated. Again, normally that should work just fine. So this is also being addressed at the moment and will be pushed out in a fix soon. Can we go to the next one, Kelly? Also, the admission date already used message, you're getting this for two different reasons. And we are looking to have it stop giving you this error message when you submit a closure with the same admission date and the same closure multiple times, because we know some of you have built that into your systems in order to make sure the closure processes. So we will be able to, in the next release or two, to get that back to not popping this error. If you try to do a new submission with the same admission date and it's marked active when a client is already closed, you'll get, this. So we allow updates on closures if the reason is different. So if you accidentally put them as left against professional advice, but they completed, you can definitely resubmit and update it to completed. Again, we're revising these error messages and the process to make it more in line with what it was doing. The fourth one is the service file adjustments are being blocked by missing IDs. We have a data fix that's going to be going in because the root cause was the historical submission IDs, which are transaction IDs for service files, weren't migrated during go live. So the fix there says upcoming in May of 2025. We did have to do a few rearrangements. So that is not, I will confirm if that has been done or not. But if you do get this, that's the reason. And I'm not sure what the next slide is, but I don't think we put in here the switching EHRs in the deck here. I didn't see it on the agenda.
No, I
No,
think
I don't.
we skipped it this time.
Okay, well, I
We
would
had
like to
enough.
say, in regards to that, if you're switching EHRs, 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 if you're swit and they have the EHR you're going to has version 1 available and functioning, you will need to come up with version 1, even if they're starting to work on development for version 2. You will not be able to wait until version 2 is available. You will, if you choose to wait, you will be entering your data through the portal in the meantime. So we're recommending that if you're switching EHRs and that EHR is already got an up and running version 1, you will be expected to submit that because we can't have you waiting 3 to 6 to 12 months of not reporting data. So I just want to make that clear.
Excellent. Thank you. Thank you, Jody. Yeah, and Trin mentioned that the first name duplication stuff and overlay and client issues what were caused by twins, because that's always the unique scenario that we have to get our heads around. And our developers of the Ernst & Young who built the road system also had to review it several times. You got into a session to make sure that we always do make the right decision, and it's always a bit tricky when you talk about that situation. So thank you.
Yeah. Yeah, and we also want to just put a shout out. There's a number of you that have been, such as Trin, that have been very diligent on tracking what your errors are and what's happening and keeping us up to speed on that. And we greatly appreciate you taking the time to do that and keep us in the loop.
Definitely. Thank you. And thank you for being so diligent. And speaking of diligent, the new documents coming out this afternoon, as Jody mentioned, we are pretty sure it's solid, but there's always going to be little tweaks here and there, little typos, naming things. There's too much information that um, based on my experience over the years, there's always something that we missed here or there. So please let us know if you see it so we can act immediately and see if we can, depending on what the impact might be, and if we can fix it right away. And even if it's just a little typo, a little something that looks off, let us know. We'll put it on the list and then try to fix everything as quickly as we can. So thank you. Okay, comfort check and question time. How's everybody feeling so far? And I see, give a thumbs up if you're good, or drop a question in the chat if you need clarification. Uh-oh.
Yay, I see a lot of thumbs.
Excellent. And the thumbs are still coming. Cool.
I see someone has their hand up for a question.
Yes, there is. And that is Andrea. Go ahead, Andrea.
Hi. Hi, thank you. My name is Andrea Brunel. We're new. We just got our certification for SED certification and integrated healthcare approval on 3/25 of this year. So we haven't done our reporting yet for Q3. I'm sorry, Q2. My question is, I have two questions. On the reporting for Q2, when is that? So we would be reporting, as of our certification date forward. For March, April, and May. When is the reporting due?
Is this for like regular SUD episodes of care?
Yeah, and so that's my next question, who we are and what we do. We're not a facility or residential acute entity or provider group. We're an IOP freestanding independent, heavily televideo hybrid provider group. So that's what type of provider group we are. And we have multiple, obviously, provider types within our group. So that's the provider type. And my next question is, when you had mentioned that there may be duplicate names of members being treated by multiple providers, would that be an issue? Because if they come out of residential and acute facility, we would be treating them outpatient in an IOP outpatient setting.
So normally, any provider within the state that is providing SUD services, a lot of it depends on the type of SUD service you're providing and who's paying for it.
Right.
And so are
So,
these public funds or are these DUI programs that are mandated
Right.
to be reported?
99% of the patients we are serving right now are on a CCO, like Care Oregon, Trillium, all of the ones that are available in Oregon.
Okay.
We service. Mhm.
Okay, so basically those clients are reported actually at more frequent thresholds than quarterly. So with the and we didn't put that one in here this time, but there are reporting guidelines for that. So when somebody enters services at your organization, you are to send the admission and all the information around that we require within 7 days of entrance to your program. And
Yes.
then, go ahead.
Yeah, I saw that on the instructions. Go ahead. So I'll
Uh-huh.
let you go. Yeah, I saw that. Mhm.
Yeah, and then at a minimum, we need 90-day updates if they're still actively in treatment, but we do need their discharge within 30 days of the discharge. So it's the reporting for these type of clients is a little bit different than just like, quarterly reporting for certain other types of grants or programs.
Okay, so we're obviously behind, and this is where we're trying to get the reporting, and we're doing it manually right now by each
Okay.
client until we can do the EDI reporting build.
Okay.
Which we have our development, Joel's on the call here as well. He'll be reaching out to, I believe, schedule a call with our EHR himself, our representative Joel, and then the roads representative. Is that correct for our EHR capability for reporting?
Yeah, Joel would want to get a hold of myself. The email Lisa put in is fine too. That's our general road support. But for getting into the development and that piece, Joel will need to meet with myself and Pete at a minimum, and possibly a few others so that we can make sure and have all the correct information. And if you can provide us Joel's contact information or whatnot, that would be helpful.
Okay, great.
Yes, I don't know if I'm unmuted or not, but
Yeah, you are.
oh, great. Yep, this is Joel, and I was the one who had asked who to contact, so that was, thanks for responding with the Rhodes email address. But if you want to drop me a note, or I can, but we're not only are we a new provider group with, as Andrea described, we are also our own EHR. We're building our own EHR, and so that's my job is to continue to build that out, and the EDI is a component of that.
Okay, super. Well, welcome. We definitely are here to support you and help you on your endeavors. We usually make ourselves pretty available and collaborative, so.
Wonderful.
Thank you so much. And for now, we'll be entering it manually, the data, so we get caught up.
Okay, and are you already set up and established to do that?
We are. We've already started entering three clients. We've got quite a few, but
Okay,
we look to get caught up in July.
Awesome. Okay, no
Great.
worries. Yeah,
Thank you so much.
you're welcome.
Excellent. Thank you. And Lisa put the email box back in the chat. Oh, there it is again. The roads at odhsoha.oregon.gov. And for specific EDI, it's jody.a.kramer@oha.oregon.gov or pete.j.vermeer@oha.oregon.gov for EDI specific. So, okay. Anything else that we might have missed or something that snuck by in the chat? Because there was a lot of chatting going on, and we tried to get an app going, and I kind of missed it, but maybe that's my bad, and maybe I should have opened it, or Kelly should have opened it. We'll work on that for the next time, because the tool provides with some sort of polling thing, so everybody can be interactive and we can actually see what's happening. So, but that's for next time. Always something to work on, always something to experiment and try out new things. So, okay, well. if I don't see anything, I think we've covered it for today, and the new documents are coming out today. Yay! Thank you all very much, and have a wonderful rest of your day.
Thanks, everyone.
Thanks.
So.